Hey, so who are you?
Hi, it's Meg Collins with Lucy's List.
Meg.
Hi. So my question is one that I know a lot of people have. And that is, after I gave birth, especially the second time, let's just say the bladder control, not so good. And Kegels, 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 all of that just really isn't doing the trick. And it's both when I jog, when I sneeze, when I cough, you name it.
Laugh.
Ha 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 ha. It's actually not. It's actually pretty terrible. Do I have any hope of regaining that bladder control back again? Or is this sort of like just life as a mom?
Really good question.
Thank you.
All right, doctor, do you want to answer that one?
Hi.
Hi.
I'm Diane.
Hi, Dr.
Diane, how are you doing? Well, this is a common problem, and unfortunately it's almost universal. Some women, it may be genetic, that your pelvic floor, just think about that, you just pushed a bowling ball out of your pelvic floor, and all of the support in your pelvis is a bone, a kind of a circular, several bones, and the opening is kind of an oval, and everything that supports all of your guts, and including that baby during pregnancy, is just a mesh of tissue. And once you push that out, all of that tends to have some degree of relaxation. We call it pelvic relaxation. Sometimes it can lead to incontinence, meaning losing urine or inability to hold, especially if you have to go really badly. That's called urge incontinence. You have the urge and you go, oh, you gotta stand there until your bladder contraction goes away and then you're okay. Stress incontinence is when you just cough or sneeze or stand up or laugh and
Yes.
your pants are wet, and it's not, you don't realize you're leaking, and you don't have to have a full bladder to have that happen. But some women will regain their bladder control after deliveries. Most women lose it in the beginning, right after they have their baby, because everything is numb. You've pressed through those nerves. You don't have good sensation in your pelvic floor around your urethra and the muscles that hold your bladder. So the Kegels that she was talking about are strengthening, holding. It's the muscles you do to hold and you go. So if you want to practice Kegels, try sitting on the toilet, voiding your urine. There's a reason for incontinence. You pee a little, hold, stop the flow, pee a little, hold, stop the flow. That's getting in touch. Sorry, we got cut off. And so is there hope for having bladder dysfunction or incontinence? Some women actually are worse than others. It can be genetic, it can be the size of your baby, and just irreversible stretching and relaxation, and sometimes nerve damage from delivering. And all those people who are like, what if I just got a C-section instead of a vaginal delivery ever? Because there's a trend to people wanting to have primary C-sections instead of vaginal deliveries. Well, let me tell you, being pregnant, period, can lead to some bladder dysfunction and pelvic relaxation because you have a big baby growing inside of you. And remember, those mesh muscles at the bottom are the only things keeping everything up there. So having a C-section doesn't prevent it. So some women will need something done. Now, does that mean they need surgery? Maybe not. Sometimes they just need a little stimulator. They can do electric implants for stimulation to help the bladder and train the muscles that are more than you can do with a Kegel. These are somewhat invasive because they do involve a procedure, an insertion, and it takes learning. Some women can do biofeedback using weights, vaginal weights, holding, just to strengthen those muscles better than they can do with just a Kegel. But usually, you know, everyone's different. Some women can tolerate different levels of leaking. Some women can't tolerate any, and like it's really bad, or they can, you know, leak a few times on a daily basis, but it's tolerable. It's really up to you, and you will have to talk with your practitioner to see if there's the severity of it, to see if you need some extra help from maybe a urogynecologist. That's a urologist that just takes care of women.
Awesome. Okay, next question. Thank you.